Lower respiratory tract infections (LRTIs) encompass a spectrum of ailments affecting the lungs and airways, posing significant health risks and placing a heavy burden on global healthcare systems. These infections, often viral or bacterial in origin, target the intricate structures of the respiratory system, instigating an array of symptoms and complications. Among the most prevalent lower respiratory tract infections are pneumonia, bronchitis, and bronchiolitis. Pneumonia, characterized by inflammation of the lung tissue, manifests with symptoms such as cough, fever, difficulty breathing, and chest pain. This condition can be caused by various pathogens, including bacteria, viruses, and fungi, and poses severe risks, particularly to vulnerable populations like the elderly and individuals with weakened immune systems. Bronchitis, an inflammation of the bronchial tubes, surfaces as a persistent cough, often accompanied by mucus production and chest discomfort. Acute bronchitis, commonly triggered by viral infections, typically resolves within a few weeks, while chronic bronchitis, often associated with smoking or long-term exposure to irritants, persists for longer durations, causing respiratory distress. Bronchiolitis primarily affects infants and young children, causing inflammation and congestion in the small airways bronchioles of the lungs. Respiratory syncytial virus (RSV) is a common culprit behind bronchiolitis, leading to symptoms like wheezing, coughing, rapid breathing, and difficulty feeding. The prevalence of lower respiratory tract infections underscores the importance of understanding their causative factors, risk factors, and management strategies. Viruses, such as influenza, respiratory syncytial virus, and adenoviruses, contribute significantly to these infections, often spreading through respiratory droplets from coughing or sneezing. Bacterial pathogens, including Streptococcus pneumoniae and Haemophilus influenzae, also play a substantial role in causing LRTIs, particularly pneumonia. Risk factors like advanced age, weakened immune systems, chronic lung diseases, smoking, and exposure to environmental pollutants amplify the susceptibility to these infections. Management of LRTIs revolves around prompt diagnosis, appropriate treatment, and preventive measures. Antibiotics or antiviral medications may be prescribed based on the underlying cause. Additionally, supportive care, including hydration, rest, and in severe cases, supplemental oxygen and hospitalization, might be necessary. Prevention remains pivotal in curbing the incidence of LRTIs. Vaccination against influenza and pneumococcal infections significantly reduces the risk of contracting these infections, especially in high-risk populations. Practicing good respiratory hygiene, such as regular hand washing, covering coughs and sneezes, and avoiding close contact with sick individuals, also proves instrumental in prevention. In conclusion, lower respiratory tract infections stand as formidable adversaries within the realm of public health, affecting individuals across age groups and demographics. The multifaceted nature of these infections necessitates a comprehensive approach, emphasizing prevention, timely diagnosis, and appropriate management strategy. Heightened awareness, vaccination campaigns, and fostering healthy practices hold the key to mitigating the burden posed by lower respiratory tract infections and safeguarding respiratory health on a global scale.